Good afternoon to the members of the public, members of the media, the representatives of the Ministry of Health and the various regional health authorities, to the members of the committee. Today, our examination is into the efficiency of the delivery of services to the public by the regional health authorities. And I therefore welcome the officials of the Ministry of Health and of the Northwest Regional Health Authority, the North Central Regional Health Authority, the Southwest Regional Health Authority, and the Eastern Regional Health Authority. I am Bridget Anizet George, and I am the chairman of this committee. The Committee on Public Administration and Appropriations, the PAAC, has the mandate to consider and report to the House on A, the budgetary expenditure of government agencies to ensure that expenditure is embarked upon in accordance with parliamentary approval. B, the budgetary expenditure of government agencies as it occurs, and to keep Parliament informed of how the budget allocation is being implemented. And C, the administration of government agencies to determine hindrances to their efficiency and to make recommendations to the government for improvement of public administration. The purpose of this meeting is to examine the efficiency of the delivery of services to the public by the Regional Health Authority. The committee intends to follow up on the implementation of the recommendations presented in the Welsh report. The role of the committee is to assist the stakeholders in achieving the efficient delivery of services while ensuring that expenditure is embarked upon in accordance with parliamentary approval. This meeting may be broadcast live on Parliament's Channel 11 and Radio 105.5 FM and the Parliament's YouTube channel, ParlView. May I ask all participants to ensure that their mics remain muted until recognized by the chair. I will therefore now invite the representatives of the Ministry of Health and the 4 regional health authorities to introduce themselves, and immediately thereafter I'll ask the members of the committee to introduce themselves. So we can start with the Ministry of Health. I believe we have the acting CEO, so we can start with him.
Good afternoon, Madam Chair. Asif Ali, Permanent Secretary, Ministry of Health.
Good afternoon, Madam Chair. Lawrence Jason, Director of Health Policy Research and Planning, Ministry of Health.
Good afternoon, Madam Chair. Dr. Stuart Smith, Senior Health Systems Advisor, Ministry of Health.
Good afternoon, Chair and members. Dr. Roshan Parasham, Chief Medical Officer, Ministry of Health.
Can we then therefore go on to the Northwest Regional Health Authority?
Good afternoon, Madam Chairman. Salisha Bash, Acting CEO of NWRHA.
Can we then invite the Director of Health to introduce himself?
Madam Chair, I believe he's having some problems with his mic.
Yes. So, all right. So can I ask you, Madam CEO, if maybe if all your members are not in the same room, if you can just let us know who represents whom?
Sure. Dr. Parkinson. Yes, Dr. Anthony Parkinson represents, he's the Director of Health. And Mr. Terran Gilchrist, he's online. He's our Chief Operations Officer, so I can let him introduce himself. Mr. Gilchrist.
Good afternoon, Madam Chair. Terran Gilchrist, Chief Operating Officer.
Thank you. Can we just continue with the Northwest Regional Health Authority? Are there any other representatives at the meeting?
No, Madam Chairman.
Okay. Can we then, thank you very much, Madam CEO. Can we then go on to the North Central Regional Health Authority?
Davlin Thomas, CEO, North Central Regional Health Authority.
Do we have the Director of Health?
Yes.
Can you kindly introduce yourself, please?
This is Dr. Malachi Ojuro, Director of Health, North Central Regional Health Authority.
Thank you. Mr. CEO, are you all in the same room?
Yes, we are.
Could you then just introduce your members, please, so that we...
We have Dr. Abdul Hamid. He is the General Manager, Primary Care. Ms. Sharon Kreft, she is the Chief Financial Officer. And we have Ms. Joanne Thomas, who is the General Manager, Human Resources.
Thank you very much. Can we move on to the Southwest Regional Health Authority?
Hi, good afternoon, Madam Chair. I'm Dr. Brian Amo, Chief Executive Officer, Southwest Regional Health Authority. I'll pass on to the Chief Operations Officer.
Thank you.
Good afternoon, Madam Chair. Stephen Allen, Chief Operations Officer, Southwest Regional Health Authority.
Do we have your Director of Health?
Good afternoon, Madam Chair. Dr. Pravin Ramuta, Director of Health, Southwest RHA.
Do we have your General Manager, Human Resources?
Yes. Good afternoon, Madam Chair. Denise Thomas, General Manager, Human Resources at Southwest Regional Health Authority.
Okay, and the General Manager, Quality Risk Improvement, is that person there with us?
Yes. Hi, good afternoon, Madam Chair and committee members. I am Listra Balgobin, General Manager, Quality and Risk Management at the Southwest Regional Health Authority.
Thank you very much. And can we now move on to the Eastern Regional Health Authority?
Good afternoon, Madam Chair. Ronald Soyafat, Chief Executive Officer. There, go ahead.
Good afternoon, Madam Chair and members. I'm Dr. Alana Best, Acting County Medical Officer of Health for County St. Andrew St. David, which falls within the ERHA.
Good afternoon, Madam Chair and committee members. I am Dr. Sasha Sankar Maraj, the Acting Medical Director, Sandy Grande Hospital. Good afternoon, all. My name is Sonia Citroen Raphael, General Manager, HR at Eastern RHA.
Good afternoon, all. My name is Amy Ali. I'm the Manager of Paraclinical Services with the Eastern Regional Health Authority.
Thank you very much. And may I ask the members of the committee to kindly introduce themselves?
Good afternoon, all. Lakram Bodo, Vice Chairman. Welcome.
Yes?
May I?
Please, Member Mark.
Yeah. My name is Wade Mark, member of the committee.
Good afternoon. Yukima Bethelmi, member.
Good afternoon. Amrita Devanarayan, member.
Good afternoon. Lisa Morris Julian, member.
Good afternoon. Ayana Webster, member.
Good afternoon. Stephen McCarthy, member.
Good afternoon, Hassel Bacchus, member.
All right, so as we all know, we would have been in receipt, the committee has been in receipt of the response to questions sent to the Ministry of Health and the various agencies. I would like to take this opportunity to invite the acting CEO of the Permanent Secretary of the Ministry of Health to make an opening statement if he so wishes.
Thank you, Madam Chair. Good afternoon again, Madam Chair, members of the committee, and my colleagues from the Ministry of Health and the RHAs. So we welcome this opportunity to review and examine the efficiency of the RHAs in the delivery of service to the public. We would have used the findings of the Welsh report to inform our interventions that were needed to improve not only our national health outcomes, but also our level of service delivery. And I just want to expand a bit on how we went about doing that. The Welsh report had approximately 39 broad recommendations. What the ministry did in 2017, we held 3 national public health consultations where we sought to share these reports with the public, but also seek their feedback on those recommendations. We also held consultations with the Trinidad and Tobago Medical Association, as well as the Faculty of Medical Sciences of UWI. Coming out of those consultations, we then came up with some discrete activities under each recommendation, which we then used to inform the work plans of the ministry and the RHAs from that point going forward. In 2018, when the ministry conducted its first status report on those recommendations, we had an overall implementation rate of 61%, with 12 activities being completed and the others at various stages of progress. In 2020, we did a second status update. We had moved to 82% implementation, with 25 activities being completed, and again, the others at various stages of progress. Madam Chair, of the concerns of the population with regard to the limitations and issues raised with the in the report. Industry very quickly. Maternal and 50 to 60 maternal deaths per 100,000 in 2015 to currently under 30 per 100,000. In case of need,
Mr. Ali? Mr. Ali? Mr. Ali? Can you hear me?
Yes, I can.
I'm seeing that you're having a low broad bandwidth, and maybe that's why you are breaking up. Maybe let's try and see if you turn off your camera, if we can hear you a little better, because we've lost you along the way.
Is that better?
Okay, so let's see. Could you go back to when you started giving some statistics on maternal deaths?
Sure. Can you hear me now?
Yes, we are.
Yeah, great. Okay, so I was speaking to the issue of maternal deaths, where we moved from 50 to 100,000 in 2015, where we're currently at 30 per 100,000. That's for maternal deaths. In the case of neonatal deaths, we moved from 12 per 1,000 live births in 2015, where we're currently at under 7 per 1,000 live births. The other achievement I just want to highlight would be the various interventions we would have taken starting in 2020 with regard to interrupting and reducing the transmission of COVID-19 virus, as well as our parallel healthcare system in respect of COVID-19. Madam Chair, we look forward to today's valuable and as we continue to continuously improving our healthcare queue. Did you lose me again?
Thank you, Mr. Ali. Can I invite the Acting CEO of Northwest Regional Health Authority to make an opening statement if she so wishes?
Hi, good afternoon all. Just a brief feedback as it relates to the improvement that we have engaged at the NWRH as it relates to the recommendations coming out of the Welsh report. We would have done significant improvements in both primary care as well as in secondary care. The details, of course, would have been submitted to the members of the committee. And as it relates to our infrastructural programs, we have done significant progress as well too, culminating with the commencement of the start of the construction of our the new central block, which is presently ongoing. And well, as I said, further details were already provided in our updates to the Welsh report. Thank you.
You're welcome. May I invite the CEO of the North Central Regional Health Authority to make an opening statement if he so wishes.
Good afternoon, Chairman. Again, the North Central Regional Health Authority, under the guidance of the Ministry of Health, had embarked on structured and continuous improvement utilizing a systems approach, which implied that we were engaging in a lot of structural changes to facilitate continuous improvement. Some of the highlights that I just want to put on the table are, we would have seen, based on our own monitoring, decreases in complaints by as much as 66%. We would have subsequently as well had a corresponding increase in, of course, commendations by 30 to 35%. In addition, our adverse events had decreased between 2018 to 2020 by as much as 50%. And our ongoing continuous improvement strategies are ongoing. Thank you.
The CEO of the Southwest Regional Health Authority, you are invited to make a brief opening statement, if you so please.
Thank you, Madam Chair. The Southwest Regional Health Authority, as part of the national architecture, I'd just like the committee to appreciate the expanse. We go from Freeport and Tabakit in the north to Moruga, as well as 3 Carcass in the southwestern tip. We have 33 health centers, 3 district health facilities, and San Fernando General, San Fernando Teaching Hospital, and the recently opened Point Fortin Hospital. By the sheer size of our throughput, we see on average about 250,000 patient encounters in our outpatient clinic services. Similarly, in our emergency department for 2019, we had close to 250,000 encounters there as well in terms of emergency department visits, and even more so in our health centers, where we crossed over 400,000 visits in 2019 from our data. We too have seen a lot of strides in our operational areas of improvement, having completed a lot of our projects that depend on funding for the public sector investment program. And pre-COVID, during COVID, and even now in 2021, we also continually monitor patient care and do quality process improvement with our main quality department. And we contribute this as all part of the national architecture taking direction from the Ministry of Health.
Thank you very much. And may I therefore invite the CEO of the Eastern Regional Health Authority to make his brief opening statement.
Thank you very much, Madam Chair, and again, greetings to the rest of the committee. The Eastern RHA is perhaps geographically the largest of all, because we take about a 1/3 vertical slice of the island, taking in from in the north, Matlot in the north, coming down the entire of the seaboard with Manzanilla, Mayaro, Guayari, Rio Claro, Brothers Road, Beach. You know, most of those communities are distanced apart and rural, and we try our very best to ensure that we provide services that are equitable in access, you know, and quality to all the people that we serve. We try to keep in touch with our publics. Annually, we do our community consultations where we host our public at each facility, each health center and the hospital and so on, and listen to some of their concerns, listen to some of the things that they would like to see happening. Just as a success story for that, as an example, 2 years ago, we had our community consultation at Toko, and the public actually pointed out that they needed an X-ray service at the accident and emergency. I'm proud to say that within a year after that, we did put in an X-ray service so that we try to be responsive to the public in terms of their needs. I want to take the opportunity also to express our deepest thanks to our staff who continue to, serve under our active banner of caring is the key, focusing on our patients and trying to ensure the quality of service that we provide. To note, for example, our complaints or annual client feedback survey, we had some comments of 358 comments for the last 2019-2020 period. Out of that, we had about 200 complaints with a resolution rate of 88%. So we try to ensure that we give feedback, that we maintain contact, and that we ensure that the quality of service that we give to our clients is second to none. And we also, I should say, we enjoy the cooperative kind of atmosphere between ourselves, the other regional health authorities, and the Ministry of Health. Thank you.
Thank you very much. And I would like to start off the conversation with something that was said by Mr. Ali, and which is also in the response that, I find quite interesting, but would like to get some clarification. Mr. Ali mentioned that in 2018, you had identified 200, I think it's either 50 or 51 activities. And from those activities, you have an implementation rate of 61, so roughly 62%. And in 2020, you've identified 266 sub-activities. So I'm trying to get some clarification if it is that these sub-activities expand over time as you try to implement. What accounts for the difference?
Sure, Madam Chair. Maybe I can start, and then I'd let Mr. Jai Singh just continue. So as I said, we have taken those broad recommendations and then broken out from there discrete activities. And you're right, as we continuously review our progress and as circumstances change and the environment changes, there will be new activities that we would identify that we would think that needs to be pursued, all right? So that's why we moved from 251, as you said, to 266. And if you ask us in 2 months' time, that number might go up to 275, yeah? So it is a process of continuous improvement, as I said, and we are continuously looking at our activities and assessing the environment and reacting to those challenges as they come up.
Thank you. So of the 15 additional, I'm going to put it this way. In getting to the 266 in 2020, would you have an idea of how many of them were activities which were identified in 2018 and which have not been accomplished or achieved or completed?
I would let Mr. Jaisen maybe speak to that. I don't have that information in front of me. I'm not sure if he can maybe shed some light.
Sure, thank you.
Hi, Madam Chair. Yes, in terms of the, PS correctly said it, in terms of the sub-activities, as the recommendations are broad, we narrowed down to our work plans within the ministry and within the RHA as well. So the activities are broadened based on their work plan framework as well in terms of implementing the recommendations. Just to answer your question as well, in terms of from 251 to 266, some of the activities came out from direct work plans, and when you look at the report itself, I went in terms of the contents of the report, other activities came out from there as well. So what we try to do is to align the recommendations as much as possible to the contents of the report, as well, and because it was arranged through different pillars, and therefore more activities came out as we actually went in depth in the report itself. And to answer your question, yes, we have incorporated these activities in the work plans, and some have been started, some have been is ongoing. So we're actually trying to monitor and track these activities accordingly.
Okay, so Mr. Jai Singh, if I understand well, there is unlikely to be any finite number of sub-activities which one could collate to say that you have achieved the objective of the report.
Well, basically, when we reviewed the second rounds in 2020, we saw that there were still some gaps between the recommendations, the broad recommendations, and what was said in the report itself. So that's why we try as much as possible to align the contents of the report to the recommendations. So yes, I agree, there should be a cutoff in terms of the actual recommendations, a list of activities under the recommendations. And we are trying to achieve that probably as much as possible together with the RHs as well. Because there must be a completion side in terms of achievement of the report, in essence.
Okay, so let me ask, what would be a completion? What you would consider a completion?
A completion basically looks at, because of the broad nature of the recommendations, we were looking at to see exactly, as much as possible with the work plans of the RHs and the ministry, how much could fit under the recommendations itself. So we're hoping that based on the 2020 plan that we have, in terms of the reporting template, that this might just be the list of activities that is aligned directly to recommendations. So it's really just reporting on those activities now. So hopefully within the third quarter of fiscal 2021, we could have, in the next couple of months, we could have a timely, again, report done as much as possible to see exactly where the recommendations are in terms of the cutoff dates.
Okay. So let me ask this. There are 39 recommendations, okay? Which, of course, when fleshed out, will lead to a number of sub-activities. But in the report, the committee had identified under some of the pillars what should be, what is best case. Are these sub-activities aligned with not just the recommendations, but the best case?
Yes, as much as possible, but we are aligned with what we try to do as well, is also align the activities under the pillars with the recommendations. Because in the report, there were no reporting template or no implementation plan. And the ministry had to develop that with the consultations, as PS indicated, and together with consultations with the RHs as much as possible. So to make sure that the activities on each pillar is aligned to the recommendations accordingly.
Yeah, I understand that. But say, for instance, in the report, let's say, for instance, they're looking at the functioning of an A&E department. Okay, and the committee would have, I think, listed about 22 characteristics, okay, which would speak to a functioning A&E department. And they do that with ward management, they do that throughout the report. What I'm trying to find out is, in your sub-activities, when you define them and you take them off, do they speak to becoming a functioning A&E department in terms of your day, in terms of your proprietary work? I want to know if they're tied back to that and not just to these, as you yourself pointed out, these very broad recommendations, which could be interpreted, in my respectful view, in any which way.
Yeah, that's correct. Because also, not only the activities were placed from the report, but also the activities from the work plan of the RHA. So if you're looking at E&E as the example, they would have their improvement program as well. So we incorporated that together with the contents of the report on the E&E as well. So yes, in the ideal state, we look to see exactly with these recommendations and activities, but the activities then that we get a deal functioning E&E department or even infrastructure by itself, taking together the recommendations from the report and the work plans from the RHAs and the ministry framework. What is the composite set of infrastructure works that need to be completed was captured in the report itself. Yes, you're quite correct.
Okay, so let me ask this. What does 61% implementation rate mean? What does 82% implementation rate mean? What does that mean?
Fine. What we did basically was looked at each pillar, looked at each activities under each pillar together with the recommendations, and line up together in one reporting template exactly what was the status of implementation of these activities, sub-activities. We then grouped each sub-activity into whatever pillar it was aligned to, and then we got status report of each pillar. Then we grouped all the pillars together and get the overall implementation rate. Now there's one side of it as well. What we also did from the recommendation side was look to see now each activity under the recommendations, calculate the percentage of status update of each recommendation, and then pull all the recommendations together, 39 recommendations to get an average rate. So the 61 and the 82 is the average rates that we, from the recommendations and the pillars, that we pull together from the activities itself.
Okay, so that overall rate you have given, you will admit, doesn't really speak to where you would have reached with respect to, say, sub-activities in any pillar.
Well, the sub-activities is a bottom-up approach. So we got the status report and the implementation rate of each sub-activity, which line back to each recommendation and each pillar. And then we got an overall implementation rate of each pillar and each recommendation, and then an overall percentage average. Yeah. So there's a bottom-up approach.
So your weighting, how is your weighting arrived at?
It is based on the status of the activities in the RHAs itself.
Okay, so might I ask, this model of assessment is designed by you, judged by you, and assessed by you. When I mean you, not you individually, within your ministry.
Well, both within the ministry and the RHAs, because the RHAs, we gave them the framework, and the RHAs inputted their data accordingly.
So there's no independent assessment or no international benchmark or anything else that arrived at the 61. It is purely subjective.
Purely internal calculation between Ministry of Health and the RHAs.
And purely internal by the process and purely subjective because it's the weight you put on it. Is the weight you put on factors that you, or sub-activities that you have defined.
Yeah.
Okay, and according to you, if I understand well, you would admit that even the sub-activities that you have defined in 2020 may not be a full basket of goods. Yes?
To some extent, yes.
Okay. Yeah. All right, thank you very much. Member Bodo, would you like to join the conversation at this stage?
Yes, thank you very much, Chair, Madam Chair. Officials of the Ministry of Health and the RHAs, PS, CMO, CEOs of the RHAs and other staff, thank you very much. I know that you are bearing the brunt of dealing with the COVID crisis, and I just want to thank you for your important service to date. PS, if I may, I just want to take you to the last page of your submission, which is page 14. So, and the item there is key limitations and constraints. And if I may just read just a few lines from your submission, the Welsh recommendations are being implemented using the current work plans of both the Ministry of Health and the regional health authorities. And I believe you confirmed this in your opening submission. And it goes on to say there are several challenges being experienced in the implementation of the recommendations, including financial constraints, the time lag in the approval and implementation process for the design and approval of projects and work activities, bottlenecks, and the creation of a parallel health system. I just wanted to ask a few questions with regards to this bit of the submission. Now, in terms of the financial constraints, when I looked at the budget allocations for the RHAs for 2019, 2020, and 2021, based on previous records and so on, I don't detect any additional allocation for the implementation of these recommendations. So is it that these recommendations would have been expected to be incorporated within the normal allocation for the RHAs? So if I can pause and just ask you to go ahead before I continue.
Sure, thank you. Through you, Chair. So, Member Bodo, that's correct. As I would have said at the start, we would have taken those activities and incorporated them into our work plan. And by extension, our budget, both at the ministry level and at the RHA level. So by and large, we would have sought to incorporate these recommendations and activities as part of our business going forward. So we did not see it as a totally separate and discrete intervention. All right? We sought to let that be part of our business, and it was included in our budget submissions, both for recurrent and development program, because as you said, part of the recommendations spoke to infrastructure also. So short answer to your question, yes. We sought to finance these activities through our normal budgetary allocation.
Thank you, PS. So let me just go down to the creation of the parallel health system to support COVID-19 treatment. And of course, we've been very fortunate to be able to have a parallel health system. Now, with regards to the staffing and perhaps the RHAs, maybe the NCRHA and the SWRHA, which I know would have been more involved in the supervision and administration of the facility